A few years ago, in 2014, we changed our mission. And part of our mission is really about non-musical growth. And, music therapy fits perfectly under that umbrella.
Jump! We're gonna jump, jump!
Alexis was born with a very rare brain malformation called left hemimegalencephaly, which basically just means that the left hemisphere of her brain is larger than the rest of her brain, causing global developmental delays, and the biggest issue was epilepsy. So September 19th, Alexis had the left hemisphere of her brain disconnected from the rest of her brain. And she's been seizure-free for 7 months since her surgery, and it just presented different challenges. So she came out of surgery kind of like a newborn baby. So she couldn't lift her head, she couldn't walk, she had trouble speaking, and once we got a little rehabilitated enough to be home, we started music sessions with Miss Allie.
When a kid comes to ChiME for music therapy, we have an assessment procedure that we go through. So this involves getting information from the parent, getting information from their individualized education plan if possible, and using all that in addition to like a live assessment where they come in and meet with me for the first time, using all that information to get a complete picture of the kid. And we're assessing in areas of cognitive skills, communicative skills, social skills, emotional skills, and physical skills. So looking in all those areas, what are the kids' strengths? What are their areas of need? And using those strengths to work on their areas of need.
Because of her surgery, the left side of her brain controls the right side of her body. So she's got some hemiplegia, she's got some paralysis on the right side and neglect of that side. And with the music, Allie addresses many different therapy goals for her, but she is able to sort of engage both sides of her body more, and it just sort of helps her with those connections of realizing her right side of her body is there. She had a lot of trouble with modulating her voice after surgery. We couldn't really hear her.
Oh, beautiful! That was really nice.
Yeah, music therapy is really a marriage of musical skill and therapeutic skill. So we learn clinical evidence-based practices that involve psychology, medicine, anatomy, and we also learn music skills, music theory, music history.
Our goal with the music therapy program is really to provide greater access. We are currently serving 3 different Chicago public schools where 76% of the children have diverse learning needs or special needs, using our general music program that's adapted for children with special needs. So we're seeing whole classrooms of children, whether that be a classroom of 6 or a classroom of 20. We're not, at this point, able to use their individual education plans to create specific goals for each student. So we have classroom goals for those. Here at our facility in Westtown, each child has a specific set of goals that they're working toward, and our services are specifically designed to help them achieve those goals.
So Gabby's on the autism spectrum disorder, behavioral disorder, which does affect social, making friends, controlling her body.
And one of the things that we've worked on since she's been in lessons is self-regulation. You know, Gabby has grown so much in that regard. She's able to, and she sees the importance of controlling her body, controlling her movements, controlling her emotions, and how that affects not only her performance, not only her musical performance, but then impacts her relationships with others. One of the things that's important in music therapy is that it doesn't stop in the therapy session.
Why are there so many songs about rainbows? And why
She's changed immensely. She's changed at home. She would not be able to control her thoughts. So after a couple months, she would control herself just a little bit more every time. Every argument wasn't the end of the world. It wasn't a tantrum. It was more, I'm gonna breathe in and out, inhale, exhale. She would be told, why don't you go sing a song to calm yourself? And she'll, hum it or quietly sing it, and I'm calm now, Mom, I could talk. So any arguments between her and her siblings improved. Her behavior at school did a 360 within about 9 months. They saw that she was able to interact with other students, which is something that she wasn't able to do before. Her social worker at school recommended continuing the lessons, increasing the time, because they saw the difference in her.
I started to be controlled. I'm starting to be calm.
She's a different child. She's blossomed. She's found herself. She's found her voice.
Music therapy costs more than instrumental instruction or group class instruction. And so sometimes it's hard for families to afford music therapy. So our biggest goal right now is to increase our funding and our capacity to really provide our therapeutic services at a very low cost.
You touch your nose, then say woohoo, woohoo. Good job. Touch